Now I request Mr. Bello to make the presentation. Topic on malaria burden and its direct medical cost of treatment in Adamawa State, Nigeria, the imperative for sustaining seasonal malaria chemo prevention.
Okay, thank you, Ma. Thank you very much. Good afternoon, good evening, and good morning to each and every one of us. Let me start sharing my screen.
We are sharing it for you from my end.
Okay, Ma. Waiting for that. Thank you.
Yeah, now we are good to go.
Okay, thank you, Ma. Good afternoon, good evening here in Nigeria. Just like you can see, my name is Mohammed Bello Haman with registration number 34471, a PhD candidate from Texila American University, presenting on this topic, malaria burden and its direct medical cost of treatment in Adamawa State, Nigeria. The imperative for sustaining seasonal malaria chemoprevention. Next slide, please. Next slide. Oh my God. Hello. As a way of background, an estimated of 241 million cases of malaria is seen globally, with 627,000 of deaths due to malaria worldwide, and 95% cases and 96% deaths were recorded in Africa, with 80% affecting under 5 children in the year 2020. And Nigeria is seen to have the highest number of global burden of malaria cases, with 27% in 2019, and accounted for the highest number of deaths, 23% of the global malaria deaths. Adamawa State is not an exception. Adamawa State has recorded 158,283, that is equivalent to 19.3% of under 5 in the year 2021. Next slide. The problem, as we are all aware that COVID-19 pandemic has been ravaging the entire world, and this has led to the high cost of direct medical treatment for malaria, which is pushing vulnerable population of Adamawa State into poverty. Therefore, between 1,300 Naira to 5,100 Naira, Nigerian Naira, is being spent for treatment of uncomplicated and complicated malaria cases, respectively, here in Adamawa State in 2021. Next slide. So in Adamawa State, as that approximately 5 use direct medical 21. Next slide. Next slide. So the methodology used for this study is retrospective, and the previous slide, please. So retrospective and purposive methodology was used for 2020 and 2021, and the sample size of 2,315,456 under 5 population of Adamawa State for 2021 was also used. And then data from district health information system 2, malaria cases, hospitalized rate or hospital rate for direct medical treatment of simple and complicated malaria, and SNC program data were reviewed, and this data was collected from the State Ministry of Health. So descriptive analysis on the treatment cost from private health facilities and public providers was assessed. Next slide. So the result of the studies is now showing that in the year 2020, malaria burden was 20.4%, and as we can see from the slide, it has dropped to 18.8 in 2021. We presume this to be as a result of the implementation of this seasonal malaria chemoprevention campaign. So the highest burden was noticed in October in 2020 with 26%, and same time in 2021, 18.9%, percent was noticed. So as we can see from the trend in this graph, that there is a slight decline in the cases in the state. This may be attributed due to the intervention carried out as a result of the seasonal malaria chemoprevention. Next slide. Next slide. For the results and discussion, direct medical costs as per public health facilities shows that 1,300 naira is being spent for simple malaria, that is uncomplicated malaria. But for the complicated malaria cases, a total of 4,350 naira is being spent per individual, making a total of 5,650 naira to be spent by individual. Despite the fact that Adamawa State is one of those states that is suffering from poverty and out-of-pocket expenditure on medical costs is very, very important. And malaria burden is very, very high. And at a point in time, one family will be having 4 or 5 cases at a time for malaria. And converting this amount to individuals that may be having malaria is something huge that needs to be looked at. And equally, for the private healthcare facility area, an individual may likely spend up to 50, so making a total of 17,415 naira. Next slide. And then for direct medical cost per case, confirmed simple malaria cases, malaria positive cases, 6,400, that is on the average. So what we presented in the previous slide is per individual in terms of public and private health facilities. But this slide is showing an average expenditure of either if an a primary healthcare center owned by an average expenditure on complete 1,700 naira. And as we all know, here in Nigeria, we are still battling with minimum wage coming below 18,000 or slightly above 18,000 naira. So having an individual with complicated malaria means that the individual will consume the whole salary of the father for that particular month. So the second component of the slide is showing the result for the seasonal malaria chemoprevention intervention, an intervention where SPAC, that is sulfadoxine pyrimethamine and amodiaquine, was administered to children below the age of 5. This is showing that in cycle 1, 968 and 18 children were reached, making it 100%, cycle 2, 97%, cycle 3, 98%, and then cycle 4, 99%. The result is showing that 98% of children below the age of 5 were reached with SPAC during the SMC intervention. Next slide. In conclusion and future step, under 5 malaria cases in Adamawa State is high, as we can see, with a burden of 19.3%. And the average direct medical cost inquired for malaria treatment in the state in 2021 was 528,683,200 naira. So seasonal malaria chemoprevention has reached 98% of under 5 children in Adamawa State. So implementation of the SMC campaign is very, very imperative towards reducing malaria cases and its direct medical costs. Therefore, we can conclude that seasonal malaria chemoprevention is potential in increasing savings of the population of Adamawa State. Next slide. Thank you for your audience. Sorry for the mixed up. I had a very poor connection then. I have switched to another network. Thank you very much.
Thank you for the wonderful presentation, Ms. Bello. Now I request the participants to raise the questions to Mr. Bello. The polling session has been opened for Mr. Bello. You can vote for Mr. Bello. We have a question for you, Mr. Bello. What is the difference? What is the difference between complicated and simple malaria in terms of treatment in Nigeria?
Well, thank you for this question. Complicated malaria is also known as severe malaria. It's a malaria case where a child or an individual will be having, in addition to fever, headache, weakness of the body, vomiting, the individual will be having convulsion, and there may be difficulty in feeding. Lethargy is also seen in those individuals. So these are the symptoms of complicated or severe malaria.
Thank you, Mr. Bello. There's one more question for you. Is there any policy in place for free treatment to underlives?
Yes, in Nigeria, there is policy for malaria supported by Global Fund to treat malaria, to make malaria treatment free of charge. But as we all know, this policy is on ground, and we normally observe shortage of commodities, and the commodities are it's not every commodity that is being provided. Normally, it's only ACTs that is being provided. So an ACT cannot treat complicated malaria.
Thank you, Mr. Bello. There's one more question. Please describe the methodology and sample size used in the study.
The methodology used for this study is prospective and purposive methodology. We just use the simple method to see the outcome of the SMC and then compare it vis-a-vis malaria burden in the state, looking at 2020 when the campaign has not taken place, comparing it with 2021 when the campaign has fully taken place, to see if definitely there is saving by the households or individuals in Adamawa State.
Thank you so much. So there's one more question for you. Does community-based health insurance cover malaria cases in Adamawa State, Nigeria?
Yes, of course, health insurance scheme covers malaria treatment, but the health insurance scheme in Adamawa State is at the pilot state, and it's not fully taking place to be able to cover the burden for malaria.
Thank you so much, Mr. Bello. I request you to put on the email ID on the chat box so that the participants can clarify their doubts personally to you.
Okay, thank you, ma'am.
Thank you so much.
Thank you.